Hey everybody, this is John Oxley from Huntington Physical Therapy doing my Friday tip of the week. 2 weeks ago I talked about overall kind of patient experience throughout your plan of care in PT. I wanted to come back to that, and so what we're going to talk about today is your specific first visit with a physical therapist. When you come to the clinic, what should you expect? The first thing of 5 is going to be you need to have a good customer service experience. We are here, physical therapists in the physical therapy clinic, we are here for you. We're here to figure out what your problems are, what you're having difficulty doing, and then figure out how can we make that better. So it needs to start off with a good customer service experience at the front desk, going all the way back to the physical therapist treatment and evaluation, and then coming back around to when you leave and you're making your next appointment. The second thing you need to get from your first physical therapy appointment or experience is you need to understand what your insurance coverage is. That PT clinic needs to be explaining to you what's your deductible, has it been met? Do you have a copay? How much is it? And when do we expect you to pay it? And then what is coinsurance? And when do we expect you to pay that? That way you can make all the arrangements up front, and there are no surprises, there are no secrets on your bill when you see it. You know exactly what this visit's going to cost and what future visits should likely cost you. So once you've been to the front desk, you've filled out your paperwork, you've gotten your explanation of what your insurance coverage is and what this appointment's going to cost you, then you're going to have your evaluation with a physical therapist. The first thing that you should get in that evaluation after they ask you these questions is, what is the cause of your problem? It doesn't necessarily have to be so specific that they give you the exact tissue or the exact anatomical structure that is the cause, but they need to be able to give you a good idea of what is generating your pain. And with that, once they tell you what's generating your pain, then they need to be explaining to you, how does that relate to the anatomy? So you as a patient understand the effects on your body, the effects on your anatomy, and why you're having this pain based on your personal anatomy. And then the third thing you tie that into is, how does the cause in the anatomy, how does that affect your overall function? Why is this pain and why is this anatomical issue that you're having, how is that diminishing your ability to do things? Or why are you not accomplishing your goals? Or why are you not able to do what you want to do? Those 3 things, you should go away from your evaluation knowing those 3 things after your first PT visit. The fourth thing that you're going to get from your first PT visit is a home program. You will sometimes hear people or see people write it as HEP. That stands for your home exercise program. So after the PT has told you what's wrong and what you need to do to get it better, then they have got to give you specific instructions on exercises and things to avoid or things to do that is going to reaffirm what they have told you and get you along the road to getting better. If you don't get a home exercise program, you're not getting the full breadth of what we should be getting or giving to patients in physical therapy. You need exercises, you need homework to get better faster. The last thing that you're going to get from your PT visit is you should get some goals set for you. Now, as a patient, you're going to have to play a role in this goal setting because the physical therapist doesn't know what you're trying to achieve. But you should certainly be sitting down with your therapist and talking about, what are your goals, what do you hope to achieve, and give a general time frame as to when you hope to achieve these goals. This is a really important part of the therapy process so that you know what to expect and the therapist has expectations of you as the patient. Hopefully these 5 things were educational. Hopefully you get a little bit better understanding of what to expect from your first PT visit. Keep the comments and suggestions coming. They've been great. I'm really enjoying doing these videos. I'd be happy to do anything out there that you guys would like me to do, so send over comments.